This morning I'm going to talk about really about process and how to go about considering whether or not you want to do outpatient total joints in your ambulatory surgery center. And if you do decide to, what's the process? A lot about how and what. So today's objectives, we're going to review current trends in outpatient total joint replacement, why this shift is occurring. We're going to look at the challenges and the opportunities and the advantages of providing arthroplasty surgery in the outpatient setting. We're going to help you understand the process, patient selection criteria, some examples there, and the implementation steps required to successfully perform outpatient hip and knee replacements. We're going to go over some of the pre-op, perioperative, and post-op protocols. I'm not going to go into a lot of great detail. I think you heard some of the other speakers speak to those in today's presentation, because I'm going to really focus on process. And then we're going to review the clinical, the financial models that are coming forward, the bundled payments, particularly around total joints. So how do you measure your success? I know there's been a lot of talk at this conference on outcomes. I'm a big believer in outcomes, and even though some of the payers may not be looking at them right now, they will be looking at them in the future. In particular, if you go back to the criteria network, the criteria that they're using for the inpatient in selecting their networks of high performance. So, but there's a lot of tools out there for success. Certainly some examples of patient selection criteria, notebooks, protocols, etc. But again, the main thing is to take what's out there and use it, but to customize it for your particular surgery center. So as we look across the board in working with these, and we look at the top 10 traits of successful ASCs, there's really 10 things that come to the forefront. First and foremost is committed, open-minded, forward-thinking administrators and physicians working together towards a common vision. Educated and empowered staff. The staff really has to be on board, and I can't iterate that enough. You really got to make sure that everyone is on board and speaking the same language. Physicians are engaged and have effective leadership. You have an effective leadership structure for decision making, that you have an effective reimbursement strategy with the right mix of patients and payers. Excellent vendor and payer relationships is going to be very important. A commitment to providing superior quality and service. Accurate financial systems, critical particularly as you get into the bundled payment models. Data that's shared and communicated across physicians and staff. You do want to have a clear marketing, although patients will go out and really rave about their service, particularly if you focus in on that patient experience. But you do want to have a clear marketing plan and be able to share your growth strategy. And facilities and equipment that are current and well maintained. So measuring success, certainly you look at the evidence. We need more evidence in this arena, as you probably learned from this conference. We need more publications. I'll share with a few of those with you here at the end. But quickly, should we do a bundled payment model? If you're asking yourself that, now I know there's a lot of information on here, but the main message is determining what is going to be in and outside of your bundle, how long is the bundle going to be for, your warranty program. There's a lot of considerations here. Looking at those triple aim goals of reducing your cost per care, but improving quality and optimizing that patient experience. So those are some of the providers that you would work with. We know one center that as they're looking at their bundled payment model, they're looking at, is there an opportunity to send our patients home and work with our wellness programs in our market to maybe cover a month's membership at a gym rather than sending them to outpatient physical therapy. So some of those types of things that are thinking outside of the box.